So before sitting in the chair, the patient will wash their arm off in order to get any kind of debris from the day or sweat or body oils or anything like that out of the way. Once they're in the chair, they'll kind of double up on that with some alcohol swabs. You want to make sure that you use a separate alcohol swab really for each site. There's a chance that bacteria could get on one site that is not on the other, so you just kind of want to use one alcohol swab per site when you're doing that. And there's a little more prep that will go into this stage that we'll get to afterwards, where they're going to use one of the buttonhole needles. This patient still uses sharps for their actual hookup, but the buttonhole needles come with a pick that is rather handy for getting the scab out of the way from previous treatments. So the patient will spend some time getting the scabs out of the way, and it's just flaky dead skin type stuff. It's rarely like a brown and red scab that you would see when you scuff your knee. It's just dead skin that's kind of sitting on top of the port, and you don't want to jab that down into your bloodstream. So this always takes place before the actual placement of the needles. So once the scabs are out of the way and it's ready to happen, you're putting the tourniquet on the arm in order to kind of pump that blood flow and get those veins to kind of increase in size and arteries to increase in size.
You have to make sure it's facing the right way.
As far as the little butterfly attachment at the end of the needle is what she's referring to, and to make sure the bevel of the needle itself is facing the right way. You'll have to ask your doctor or nurse to refer you to which way they had rather you do that. Some clinics do it different ways than others.
We first do the arterial. You want to do it on a 25-degree angle. And I'm not sure if y'all will see. But there should be blood that will fill the tip. So blood is starting to fill the tip of this. I'm trying to find a flashback. That's when the blood is pulsating. And there's the flashback. As you can see, it's pulsating, flashback. Now I want to lower the needle and insert it.
And once I can see that there's about 1/8 of an inch left of the needle sticking out, then I move in and kind of secure the tube so it can't slip back out. and that gives her a free hand to grab one end of the tape. Flatten out her butterfly, and then we can secure the needle to the patient's arm at that point.
And look at how beautiful that went in. Pulse, flashback.
So depending on what kind of needle you have, you'll get used to what you can do comfortably or what's comfortable for you. I usually slide the guard down just so it's out of my way, and I've got my clamp here. What I want to do is bring the blood down, prime this line. So once it's down at the end, I just clamp that off and take one of my syringes, and I can go ahead and throw away this cap, put my syringe on, and draw some blood in and ask the patient, how does that feel?
Feels okay. You want to make sure you're pulling it up without pulling onto this tube that's in the arm.
And trust us, when you first start, you'll have the tendency to kind of pull back away from the patient just because you hooked up a line.
Right, that's why I keep my finger right here.
So push it a couple times, make sure the patient doesn't feel any pinches or squeeze, and then you'll take your blank tube and throw it away. Reach over and grab your saline tube and put it on the line. Pull some in and then give it a few thumps to get any air bubbles out of the bottom of it. And then squeegee that back and forth a few times.
That feels okay.
And then leave that alone. Now, you'll have your tape station over here, so you get your next piece of tape, which is one of these thin ones. Alright, and so I'm going to feed this underneath that tube. And this might be kind of hard for you guys to see, but I'm going to make a V with my tape. One leg right there, and one leg right there, and that kind of keeps it anchored into the arm. So one more piece of tape just to secure everything down. And this final piece of tape, you'll take one of your bandages, your sponges, fold it in half, put it in the center of your tape, flip it over, and lay it right over the patient's arm like so. So that just protects the actual needle site itself. And now she's ready to move on to doing the venous needle the exact same way.
Now I'm doing my venous line.
So most of the time your sites have to be at least 2 to 3 fingers apart from each other. And so her venous site is about 3 fingers above where the arterial site is. And she's doing the same thing. She's got to fish this in there at about a 25 to 30 degree angle, and she's looking for the blood to come in, and then for there to be a slight pulse to that blood. Blood is already in the tube now, and she's looking for a little pulse. There's the little pulse. And you as the caregiver, you can help spot that and just kind of be ready for everything. So once again, I'm getting my tape ready to go, and I'm watching for her to get it far enough into her arm that I can reach out and grab it, and she can let her hand go free from it. So once again, I just reach in and secure it. She flattens out the butterfly part, and we lay down this first tape.
Make sure you do not tape on top of this previous one.
It's not going to severely damage anything, but it does make it difficult. The tape really does like to stick to itself once it gets hot, and so with the temperature of your body, it's going to get hot. And that means that it's going to stick to itself and be difficult to get off later. So just try to avoid sticking the tape to tape. So same thing, I just fed the blood all the way down to the end. I used my clamp, and now I'm going to get my syringe that I have waiting on me right here. I just remove this end, get rid of it, take my blank syringe and pull some in. How does that feel?
It's okay.
So, and you can do this 3 or 4 times just to kind of make sure the patient doesn't feel anything weird.
There's no pinch, or if it feels too tight, maybe you'll feel a little pinch, and that means that the needle might be too close to the wall, and you might need to adjust it a little bit.
So I threw away the blank, and this is the saline needle once again, just like we did on the arterial. You just flush some blood in and out to make sure it feels okay, and then you put some saline in the line, and that kind of keeps it from clotting up on the patient. You've got a little time to work while you're getting the lines ready to be hooked up. So I've run the saline into her. This patient has heparin also, so we take the saline off, and at the last stage here we have another hypodermic standing by that we do the heparin with. So this one, you'll notice, still has the end on it. Your heparin vial will look like this. You take your end off and you pull in 5 or however many the doctor has told you the patient is prescribed for. Stick it into the top. Draw your 5 cc's of heparin. Then you'll take the end of the needle, pop that back on, and then just unscrew that needle, and you're left with the regular syringe. And then we put that on the patient's line and mark the time that the heparin goes in, which tonight is 12:05. And once again, you squeegee that a couple times back and forth to mix real well in the bloodstream, and then clamp that off. And then you're ready to do the same procedure with the what they call the butterfly or the V tape. So she's holding that up for me so I can slide it right underneath, and then I just make my V over the top of that. And I get my last piece of tape that has the bandage on it set up. At this point, the patient's removing the tourniquet. That part's not needed any longer. Now the sites are secure, and for the heparin we wait 5 minutes, so we're not going to drag you through that. We're just going to wait that amount of time, and we'll be back with you here in a moment. So now we've waited the 5 minutes necessary for the heparin dose to take effect and thin out the patient's blood a little bit. So we're going to go over to our saline bag and disconnect our arterial line. It will be the one with the red clamp on it. So red end and red clamp if you're using the same setup with tubing that we are. And it will be the bottom of the 2 sites if you're set up the same way with a fistula the way that we are here. So I'm going to take my tube off. I'm going to put my arterial tube on my arterial line and unclamp both of my clamps. Then I'm going to go back over to my saline bag where I have my blue line hung up, my venous line, and same thing, I'm going to bring it over, and it is the blue line with the blue end, and it is the top line on the patient if you're set up with a fistula. It runs in the same way this patient's does. So once again, once that's secure, I unclamp and unclamp, hand both lines to the patient. Then I move to my machine and hit my kidney button to start treatment for the patient. Now before I tape my lines down or anything like that, I'm going to make sure that the blood goes through the machine. So we are watching the blood go through the line to the arterial pod up to the bottom of the dialyzer. You'll see the dialyzer start to change color into kind of a pink color as the blood moves up through it. And you'll see it in the header, and then it comes out this line across the top of the machine and down the line into the venous supply for the patient. You'll see it change color. Once all of that has happened and it all looks good, then we go ahead and take a piece of our tape, tear it in half. Usually don't need too much for this. And we secure right here so that the lines won't move anywhere there. And then we take our lines, and since we might need access in an emergency situation to this saline tee, we put the tape here and here so that that is right there if we need it, and the patient has a little slack in the line so they can still move their arm if they need to, and that's all good. So she'll be going through this for the next 3 hours or so, barring any incidents occurring during treatment, which sometimes do happen, but there are instructions for them. Just use your books and you'll be fine through most of those. Just keep her cool and keep your patient happy. Ma'am, are you doing okay? Alright folks, so that's how you hook someone up on home hemodialysis.
Megabits per second for only $44.99 a month. So don't let your business settle for slow internet. Call 8.
So several times during treatment, about every 20 minutes or 30 minutes, the machine will beep or the iPad will beep to give you an alarm that lets you know that you need to check your blood pressure. So you just check your blood pressure and then enter the data onto your sheet if you're using the sheets, or into your iPad if you're using the iPad.